السلام عليكم ورحمة الله وبركاته. كيفكم يا شباب؟ لعلكم بخير إن شاء الله. Today we will be talking about one of the most important topics in the clinical communication skills, which is medical error. In the medical error scenario, you will start usually talking to the patient by the fixed beginning. If you are talking to the patient himself, so you will start by asking the patient firstly, so you have to identify yourself. So you will tell him that, hello, my name is Dr. Bedri, I'm a candidate of the exam today. And then you will ask the one you are talking to him about his name and his age, if he's the patient himself. And if he is not the patient himself, so the steps of the identification will be divided into three steps. So assume that you are talking to the patient himself. So you will start talking by identifying yourself. Hello, my name is Dr. Bedri. I'm a doctor in the, like, for example, heart clinic, if you are assigned to the cardiology clinic. Am I talking to Mr. Ahmed, 65 years age? So the answer will be yes. Nice to meet you, Mr. Ahmed. Nice to meet you, doctor. So we are here today to discuss some issue related to your health condition. Is it okay with you? During our conversation, if you need to ask me any question, do not hesitate to stop me. And before we start, can you tell me please what exactly happened? So he will tell you about his complaint. So why he is angry, why he is he thinks that he is not treated well. يبقى your response after finishing his talking. طبعا دايما في السيناريوهات بتاعت الميديكال ايرور بيكون واضح يعني في السيناريو is it an error or not. So your response will be like that. Yes, you are right, Mr. Ahmed. You came complaining of كده 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 كده, and what happened is كده 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 كده, and that's right. And I want to tell you that this is an error. So number one, you have to admit the error. Number two, you have to apologize. So, and I'm very sorry for what happened to you. Please accept our apology in behalf of the medical team. And then you need to set an action. So the action will be divided into two parts. Either if it is a medications error, so you will start by stop the offending medicine. So you will tell him that what we are going to do now, I already stopped the medication that caused this problem for you. Then I wrote an incident report about what happened, and I wrote that in your electronic file, so that will not happen again. And I informed my supervisor, and I informed the risk management team in our hospital. And also there will be an investigation. So we will discuss this in our meeting tomorrow, and we will initiate an investigation to see what exactly happened. And also there will be an action to prevent that from happening again. So these are the steps of the actions that you have to do in medications error. And if it is not the medications error, like if you have, let us say that you supposed to write an investigation for a patient, but you didn't. So here it is not a medication error. So step one will not be stop the offending medicine, because there is no offending medicine. So you will start by writing an incident report. So you will say to the patient, I wrote an incident report, and I wrote this in your electronic file, and I inform my supervisor and the risk management team in our hospital, and we will discuss this in our meeting tomorrow, and there will be an investigation regarding what happened, and there will be an action to prevent that from happening again. So these steps are fixed. That's why the medical error scenario, which is very frequent in the exams, is an easy scenario actually. Your challenge will be just to write, to read the scenario effectively, and collect all the informations from reading the scenario, and then do these steps by the way that I just explained to you. And after that, you have to see how these actions that you explain to the patient or to the next of kin is accepted from the other side or not. And then you have to address their concern. If there is any concern, you have to ask about it and address the concern. In the scenarios of the medications error, do not summarize. You will not recap what you discussed with the patient again, because you don't want him to be angry again. So you will skip the recap or the summary of the scenario, and you will change that or exchange that with the plan of management. So now we need to focus in your current situation, and we need to refer you to group of specialists in order to take care of you from this point on forward, and have an agreement with the patient about the future plan of management. But do not like recap or repeat what just you discussed with him again. This is an example for the common scenarios of the communication in the MRCP exams. Thank you, Dr. Bedri.